right. So when it comes to treatments, so you look at all those factors that we just looked at. When it comes to treatments, you actually want to start with prevention so that you don't get to treatment, right? So that's how we say prevention is key. If you stop it from happening, it's not going to happen, then you don't require the treatment. Okay. So when we're looking at prevention, um, so the most common prevention stuff is your pressure care cushion. So for the people that are wheelchair users on a daily basis, your cushion is very important. Okay. Sitting upright in your chair, so no leaning like it's a golf one driving, no weird. Every time you need to sit in your chair, you actually need to be optimally positioned so that your cushion can do what it needs to do for your bum area so that you don't get the source. Your pressure relief techniques, adequate nutrition, that is good for skin integrity, maintaining it. Friction and injury prevention, so bumping yourself and not transferring properly. Avoid moisture, and I'll go more into detail with that. Do a daily skin inspection. So every morning, like I always tell my patients, every morning, if you're a wheelchair user, during the day, every morning when you wake up, before or after you get showered, check your skin, check all the common areas, check your head, shoulders, the whole body, inspect for anything, whether you cut yourself, whether you scrape yourself on something, any pressure sore areas. It's the easiest time to check is when you're getting dressed in the morning. And then again at night, when you change from clothes to pajamas or you're going to take a shower, you're doing another skin check. So it should be twice a day. All right. And then positioning yourself in your wheelchair in your bed. So those are the things that you really need to do just to stop yourself from getting a pressure sore. If it does happen that now you do have a pressure sore from whatever happened, and if it's a stage 1, so like I said, a stage 1 you can treat at home because all it means is just that you have some red in that area that's affected or some discoloration. We can still save the area before you have to go to a clinic or a hospital. So what you do is, if it's a stage 1, you can see, okay, you did a skin check, and here on my knee, I have a red area. All you need to do is you stay off that area. So nothing must be touching that area. You can massage it with ice around the area just to reduce the swelling. And then you find and address the cause, okay? So maybe the reason you have a pressure sore on your knee is because you're sitting in your chair, but your knees are against the wheelchair bars on the side, and that's a pressure area. So then the way that you sit, pull your knees together and make sure that you're sitting optimally. All right. So find and address whatever's causing that pressure sore. And then you check and then revise your pressure relief techniques. Usually covering the area works. There's also get some gauze, the normal gauze with normal saline or water, and you cover that area, stay off the area for a couple of days. It should clear up immediately. If it happens that it's a stage 2 to a 4, then you seek medical attention, okay? Because now it's starting to open up, the skin is breaking. So then at the clinic, you go to your clinic. If it is bad or worse than they thought, then they will refer you to a hospital. But at the clinic, then they would give you the hydrocolloid dressings or they clean the wound for you and then they dress it for you. They can give you antiseptics or antibiotics depending on how bad it is. If it is really bad and they send you to a hospital, some people require a skin flap. So they keep you on bed rest. And if they see that it's not closing on its own, then you need to flap. So basically they take skin from another area and then they put it on the affected area and then the skin grows from there just to close that hole. So we don't want you to get to a 2 and a 4, especially a 4. Okay. And then just to go back to before I move forward, yeah. The pressure care cushion. So for those players that are using wheelchairs daily, please make sure that you check your cushion and you have your wheelchair maintained at least once a year. Okay. So I know with especially the public hospitals, they don't know how to seat people. And chances are you're going to get a pressure sore at home more than you would get it at basketball. Okay. So you must always make sure that your cushion, you get a new cushion every year. You maintain your cushion, so it mustn't be wet, it mustn't be dense. They need to maintain it and you're seated properly. So what I will do if I do get a chance to see the team is I'll start checking your wheelchairs and start checking your cushions to make sure that what you're sitting on most hours of the day is actually optimal for you compared to the pressure sore that you would get, which is highly unlikely on a wheelchair basketball chair. All right. So these are the pressure relief techniques. So this is the easiest way to avoid a pressure sore, all right? These are the most common ones. So leaning forward is the easiest one. So basically all you do is you lean forward and you touch your toes and you stay there for 2 minutes. So pressure sore, pressure care, you're supposed to do it every half hour for 2 minutes. So every 30 minutes, you're supposed to do pressure care for 2 minutes, okay? Even as an abled person, I can feel now I've been sitting for a while, you can see I'm moving around, I can shift, and it's been less than 30 minutes already, okay? So for the wheelchair users, same thing applies. Every 30 minutes, for 2 minutes, you need to do pressure care. So either you lean forward, the most common one. Some people prefer to push up on their chair, but then your upper body strength needs to be really good to stay there for 2 minutes. And then if you're lazy, you can do one bum at a time leaning sideways. So 1 minute on one side, and then 1 minute on the other side.